who have raised serious allegations has tried to...
If doctors do not have clear guidance or have a reason to distrust what's coming out of the CDC, they cannot make informed decisions to protect their patients. Children, and I would say adults' health is at risk. The Senate confirms her. The Secretary said in her swearing in that she has, quote, unimpeachable scientific credentials, and the President called her an incredible mother and dedicated public servant. Like, what happened? Did we fail? Was there something we should have done differently?
How did Dr. Monarez go from being a public health expert with unimpeachable scientific credentials, who had the full confidence of Secretary Kennedy, into being a liar and untrustworthy in less than a month? That is quite a transformation. Well, I think the answer is fairly obvious. Dr. Monarez was fired because she refused to act as a rubber stamp to implement Secretary Kennedy's dangerous agenda to substantially limit the use of safe and effective vaccines that would endanger the lives of the American people and people throughout the world. Public health and the truth itself. Unacceptably, we now have an HHS secretary who does not believe in established science.
Since my removal, several explanations have been offered. That I told the secretary I would resign, that I was not aligned with the administration priorities, or that I was untrustworthy. None of those reflect what actually happened. I will share the details, but I want to be clear. Today should not be about me. Today should be about the future of trust in public health.
The American Academy of Pediatrics, the country's largest professional association of pediatricians, representing over...
On the morning of August 25th, Secretary Kennedy demanded two things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not pre-approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts. He told me he had already spoken with the White House several times about having me removed.
We know vaccines save lives, yet all 17 voting members of ACIP, the committee that sets vaccine recommendations, were replaced with critics. Flu campaigns were halted despite 270 pediatric flu deaths last season, the highest non-pandemic total ever, with 90% of those children being under or unvaccinated. Instead of promoting vaccines, the secretary spread misinformation and promoted unproven treatments. CDC's labs and data systems are our nation's first line of defense against pandemics and biothreats. But those defenses are being weakened. Under the secretary, global flu sample submissions have dropped by 60% and COVID samples by 70%, leaving us with far less visibility into what's coming.